resilience into health system strengthening initiative. And we have a line of experts who would be sharing their insights on this very beautiful topic. The session will be in twofold. We'll start with a keynote address from Dr. Amina Aminu Dorei, who would set the scene for the panel discussion before we dive deep into the discussion proper. But before I introduce Dr. Amina to the stage, I would want to engage the audience a bit. Can we get a volunteer within the audience who would, in less than a minute, articulate what their key expectation is of this session? And please, you can use the mic on that part. All right, please go ahead in less than 1 minute. And just a few ground rules because of the size of the room. If you have questions or comments, you could just move towards the microphones situated across the aisle in the room. Please go ahead.
All right. My name is Nsika Emmanuel Kiri. I work with Breakout Africa, and I'm also an Oxfam Climate Justice Youth Ambassador. I look forward to leveraging the key insights from these discussions, global perspective on innovative climate resilience in tackling some of the key issues affecting young women and girls in Nigeria, most especially in underserved communities and unserved communities in Nigeria, in the north as well as in the east. Thank you.
All right. Thank you very much for sharing your expectations with us. And I hope the speakers got these expectations and will be able to meet your expectation. So next, we'll be diving into the keynote address. And it's a pleasure to introduce Dr. Amina Aminu Dorei, who is a senior country director with Pathfinder International, overseeing overseeing Nigeria, Niger Republic, Burkina Faso, as well as Democratic Republic of Congo. She is a public health physician with over 20 years experience in managing projects that are aimed to increase access health service to women and children, especially those in underserved communities. She has a bachelor's degree in medicine and surgery, as well as a postgraduate degree in public health in the University of Europe, with various certifications from prestigious universities like University of Washington, as well as the Harvard School of Public Health. Please join me in welcoming the family.
Thank you. Can you hear me? Can you hear me? Am I audible? Thank you. Thank you for choosing to join us today. I think there are so many. I think there are two more sessions, but for you to choose to join us, I think we are really excited, and I hope that you will take making the food to where they will sell. And you can imagine how I think someone else, even the mandate secretary, talked about how heat stroke was a cause of some deaths in even in FCT. You know, so again, the World Economic Forum, it reports that floods account for about 43% of all recorded natural disasters worldwide, and they have affected more than 1.6 billion people between 2000 and 2020. But that is also closer to home because in Nigeria, about 4.4 million Nigerians and 2.6 million children have been affected by floods in 2022. And that is just one of the natural disasters that is caused by climate change. But at least that is really something that is close to home. We have hurricanes and many other natural disasters, that may be prevalent in Nigeria or in our neighboring countries. Funny enough, when you look at even the issues around agriculture, for instance, with climate change, food and agriculture has been our major, area of concentration around our resources in Nigeria, apart from petrol, for instance. But this hugely is affected by climate change. So the intersection between climate change and health are becoming increasingly apparent, particularly in how it affects access to healthcare and the resilience of our health systems. So this continent in Africa, we are really grappling with a lot. Uh, and most of them are extreme weather events, as we mentioned. So the we are more vulnerable in addition to our systems not working. So for rural communities that are already situated in, very rural areas and the healthcare facilities are rural, there are damages that really happen because of the floods, because of the droughts. And most often, someone talked about water. The lady that, if you were in the session, you will also know more about water access and how we're just using very little amount of water per individual compared to the developed countries. So access to water, even though I think for me, I would say is, being poor in the midst of many. So we're not able to manage the floods, but we also have droughts. So, in response to the climate crisis, we actually believe in taking action at the local level. So, we believe in local action, community action, and we believe in promoting equity and implementing climate solutions that are really rights based, that are gender transformative, and that are led by women and young people. We have heard that yesterday's youth pre-conference was very, very interesting, and I hope that we'll learn more from some of our youths that attended that conference. So today, our discussion will really focus on learning from our speakers on how effective and sustainable and inclusive solutions ultimately help to ensure that we have a more strengthened, more resilient health system. And by doing so, we have the opportunity to inspire the next generation of leaders and unleash the talent and creativity of women and girls everywhere. So at Pathfinder, we believe climate change is not a challenge we can address alone. And we work with diverse partners to realize our vision for change. And Pathfinder is connected with local alliances, local partners such as Nigeria Health Watch, government, donors to address these challenges. So, really, in closing, I just want to thank each of you for being part of this important conversation, and then to also reiterate that the challenges we are facing are immense but not insurmountable, because we are all here to really learn and to, discuss solutions. Through our shared knowledge, through our partnerships, and a commitment to equity, we can create a future where climate resilience is built into every facet of our health system, and where no woman or no girl is left behind in the wake of climate disasters. I hope this session will spark new ideas and collaborations that will lead to real and tangible solutions. And together, we can transform the future and build stronger and healthier and more resilient communities. Thank you, Hafiz.
Please, round of applause for Dr. Amina Aminu Daurayi. You can see through her speech, there are key themes that came out. Things like communities, locally led solutions, gender transformative solutions, youths, partnerships, and those are centered to our discussion today. Before I introduce the panelists, this is a last minute request, so I'll be requesting Dr. Amina Aminudore to remain on the panel discussion, and I hope that doesn't put me in trouble tomorrow.
Thank you.
Hope that has been.
That's fine. Thank you.
So next, producing Ms. Amidat Abdisalam. Ms. Amidat Abdisalam is a dynamic change maker dedicated to advancing human rights, gender equality, and climate justice. She has a strong foundation in research, advocacy, and program development. As a feminist, she advocates and she amplifies marginalized voices, champions Africans' feminist narrative to empower women and girls. She has, over time, consistently demonstrated her capabilities to facilitate transformative change and amplify the intersection between climate and other social issues, which makes her a very good fit for this conversation. Please join me in welcoming Ms. Amidat Abdisalam to the stage. All right. Next, I'll be introducing Mr. Kenneth Akpan. Mr. Kenneth Akpan is a climate justice expert, activist, advocate, and researcher. He has worked extensively on climate change, environmental justice, youth development, movement building, as well as sustainable development. He is the climate justice lead for Oxfam and the Coalition for the African Activists for Climate Justice Project in Nigeria. Please join me in welcoming Mr. Kenneth to the stage. All right. So just to check in with the technical people, do we have the virtual participation online? So I'll be introducing our last panelists who will be joining us virtually from Tanzania to share some of their experience in implementing a women-led climate resilience program in Tanzania. Join me in welcoming Mr. Festus Komba. He is a senior technical advisor with Pathfinder with over 11 years experience in the health sector in Tanzania. He integrates health with biodiversity conversion with a focus on population, health and environment, RAMCA, as well as gender-based violence interventions. He has a postgraduate degree in public health from Muhimbili University and is a fellow in the clinical exchange from Umea University in Sweden. Please join me in welcoming Mr. Festus Komba to the conversation. Hello, Mr. Festus. Please confirm if you can hear us, and we'd love to hear your voice before we dive into the session.
Hear you, Afis.
Okay. That's a bit too loud, so technical people, please take note of that. All right. So I'd love to start with you, Ms. Adibat. Being the dynamic change maker that you are, with a lot of experience in human rights, climate justice, listening to all the conversations we've had through the day, as well as even the keynote speech from Dr. Amina, it has highlighted how climate change does not even affect women and girls in various domains, not just their livelihood alone, but their health, and even increases some of the health indices, worsens some of the health indices in Nigeria. As an advocate, could you share with us some insights on how climate change disproportionately affects vulnerable population, particularly the subpopulation of interest, which is women and girls? and how we can integrate gender-sensitive approaches into climate programming. Thank you.
Actually,
Yeah, please just go ahead.
at this point, I think my voice will cover the room. Okay. Yes. Can I be heard now? Are you all hearing me now?
Please go ahead.
Abs-
Okay, you speak with you.
Okay. 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 I can hear myself clearer. So thank you. Good afternoon to everyone that's taking out their time to join us in this room. I would say we are all change makers to even consider being here to want to contribute to this very important discussion. And I really love the lineup of conversations that has been had during the conference following up to this, because one thing is certain, or one thing that has reiterated time after time in all of that conversation, is that climate change is beyond an environmental issue. It is a human rights issue. It is a social justice issue. It is a nutritional issue. It is an health issue. So we've seen that time after time. And I want to ask a rhetorical question, not because I need an answer, but because I want our thoughts to flow in the same direction. We've said it time after time. It's not news that we had one terrible heat wave earlier this year. Was it February or thereabout? And to us, to a lot of us in this room, because I consider all of us here the privileged ones, because it is even a privilege for us to be in this room. So to us, it is a huge inconvenience, right? It is, oh, the weather is so hot, no amount of AC can couple the effect of this heat. That is what it was for us. But to many Nigerians and to many other people across the world, it is a survival issue. It is beyond mere inconvenience like we see it. So being in this room means we need to see beyond our lens and see from the lens of the masses. Those are the people that are not as privileged as we are to see climate change issue as just an inconvenience. Their lives are at stake. And even in the issue of their lives being at stake, some demographic are still at a disproportionate advantage than others. These demographic include women and girls, persons with disability, older people. So even now we've established that everybody's life is at risk. It is still not equal. Some people still feel these effects more than others. Women feel the impact of climate change more than men due to existing barriers that we already know, due to the way our society is already constructed. Reports had already shown that women are 14 times more likely to die during crisis than men because of their primary and caregiving roles. Women are primarily responsible for domestic chores. You know, typically in Nigeria, they will expect that you are the mother, you have to look after your children. There's a crisis, everybody's running helter skelter, but I have to think about my children. I have to think about my health. Imagine me getting my period in the middle of a flood. Or imagine me, a pregnant woman, trying to struggle and get myself together when every other person is running for their lives. So I'm already at a disadvantage. And amidst all of this, people are not necessarily seeing it differently that my roles should change because we are now in crisis. They will still expect that I go further to get firewood to cook, to search for clean water. And typically, I'll be the first to drop out of school. Because if we are being honest, in many Nigerian homes, the social cultural barrier is so much wide that it has now intertwined and affects every other aspect of social development issues. Because now there's already a climate crisis, I've had to leave my home. You're already in an IDP camp. Even if there's an opportunity, let's say NGOs come into the IDP camps and they want to help us out. My parents are more likely to say my brother should go to school first or should, unless it is specified. So I'm already at a higher disadvantage. My health risk is increased. Pregnant women or women in general, no access to your sexual reproductive health facilities in all of those forms. So generally, climate change is so much intertwined with other social development issues, and one is directly or indirectly proportionate to the other. Like they work together. Like Dr. Amina said earlier, there can be increase in child marriage because of climate change. Because now we are out of our homes, parents want to make extra cash. It is easy to dispose of the girl child. You know, it's all these things happens time after time. We have seen it, and so it's just a matter of all the sociocultural barriers that have been embedded in us as a society, compiling up to just worsen the situation for women's health and climate change in general. Thank you.
All right. Thank you very much, Ms. Amidat. So we want to just hear from a climate justice perspective, Mr. Kenneth. When we talk about climate justice, things that come to mind is are either equity and fairness, human rights, as well as vulnerable communities. What role would you say that climate justice plays in achieving health equity, and how can we work together to mitigate climate-related health disparities?
Thank you very much. Thank you, audience, for joining us today. And Dr. Amina, thank you for that opening remark earlier on. I'm happy to be here. And thank you for highlighting all of those sickness and identifying the disease that is out here with all shall see it. See that as the disease. And then climate justice is the medicine. So climate justice is about highlighting these things she has highlighted and saying, no, there has to be a cure to all of that. How do we cure? How do we approach it? But first and foremost, you must know that this is a sickness, this is a disease, which she has highlighted. That is one. Knowledge, education. And then you now want to say, okay, we need to solve this. And that is where climate justice comes in. Climate justice is about equity and making sure that those vulnerable people, which they both have talked about, women, girls, the old, people with disability. It will surprise you to know that close to 100,000 women die every year just from smoke because they're just trying to provide for their families. This is on record for Nigeria. And this wouldn't have come at a better time. For the first time, health and climate was seen as a nexus that needed or needs to be seen as it is. Previous COPs have come and gone. Health wasn't an issue. But last year, it came up to the forefront, and there's a $1 billion grant for it. But what we are saying is that for us to get to that level of understanding where climate justice comes in, we need to identify this, which we have. How can these people be dealt with, especially not in a collective miss? These people, for example, the flooding that happened in Borno, we know the people that suffered more are still suffering more. Those at IDP camps today, most likely they don't have anywhere to go. But some of people that that thing affected them together with, they have alternatives. Those people that are well-to-do maybe have gone to another state, they have gone to be with their other relatives and all that, or they have capacity to move to a different city. Climate change and climate justice has to be addressed as it is because it goes beyond Nigeria. One very big climate injustice is where I was in a conference, I made mention that Nigeria, our index as a poor nation is because we don't have enough doctors to go around our population. And then the global north, who are called the first country and doing well, open our borders to absorb all the poor remaining doctors that we have. And then they move out of our shores, they go over there, and then they leave us still empty. And what does that make Nigeria? A more poor nation. So for me, that is injustice. So these are the little nitty gritty that we need to identify and begin to see how we amplify these voices, this situation, and make sure that the right quarters get to hear and know that we know. People in the vulnerable communities cannot speak out. I lead a project called the African Activists for Climate Justice. It's basically to amplify the voices of Africans. In negotiation tables, you don't find us there. Where the matters, where they are taking major decisions about us. Earlier on, I was in the hall about the lady talking about, how many minutes do I have, please?
Just a minute.
Okay, about the lady talking about art and water. Very beautiful. But I was also thinking, until she said she is a naturalized Nigerian, I was wondering, somebody from outside telling her stories. It has always been like that. The image or the picture of climate change is the polar bear. But how come it's the polar bear when we don't have polar bears here? We should have our own story. And that is what climate justice is all about, telling our own stories. Our image of climate change should be the goats in our backyard, the chicken out there, things our children can relate with, but not always waiting to hear the narrative from outside. Climate justice is knowing your rights, my rights, protecting our rights, and the rights of most especially people who cannot speak or talk for themselves or be in this room, as she had earlier mentioned. Thank you.
All right, thank you very much, Mr. Kenneth. So moving on, we'll be trying to learn from the work Mr. Festo has done in Tanzania. So, Mr. Festo, could you describe how your work has incorporated population, health, and environment consideration into health systems strengthening efforts in Tanzania? What lessons can be learned to be applied to enhance climate resilience?
I hope you can see me, Afize.
Yes, please go ahead.
Yeah, thank you very much for this opportunity to share experience from Tanzania with regard to population health and environment approaches here in Tanzania. Also, I would like to thank Dr. Aminata for very good introduction. So for Tanzania and Pathfinder perspective in general, I will start with the introduction on what Pathfinder is doing over the past decade. Pathfinder International, in partnership with conservation organizations, has led the way in enhancing health and climate resilience through innovative integrated programming that measures population health and environment strategies. So Pathfinder PHE model aimed to combine SRH services with conservation efforts and fostering a positive outcome for communities while protecting fragile ecosystem and biodiversity essential for their survival and livelihood. For the case of Tanzania, Pathfinder support 4 PHE projects that integrate family planning, maternal, newborn and child health, adolescent and youth sexual and reproductive health services, and gender-based violence services in conservation initiatives. The project have been operational since 2011 and focusing on underserved population living near conservation areas. So the key component of Pathfinder PHE programming in Tanzania include integrated sexual and reproductive health services, here where we're supporting community health workers to do household visits and community awareness creation in the community, but also we are supporting government health facilities, and we are also doing special events and integrated mobile outreach to underserved communities. But also we have PHE school clubs established in schools to educate and engage youth and young people in PHE issues in order to foster a new generation of informed advocates for health and conservation. We are also supporting model households, which aim to engage households as unit of change to promote positive population health and environment practice at the household level, but also encouraging broader community adoption of sustainable health and environmental behaviors. We are also having community conservation microfinance groups. These are the groups which support microfinance initiatives that empower communities to achieve economic resilience through inclusive and environmental friendly income generating activities, but also enhancing both health and economic resilience. We also have green and inclusive clinics where we develop innovative clinics model that are environmentally friendly and accessible to rural populations to ensure health services are available in this fragile setting in a sustainable manner.
All right.
So,
Thank you very much,
yes.
Mr. Festus, for sharing some of the lessons. We've just been told by the organizers that our time for the session has been shortened. But of course, if the participants want to learn more about the PHE project in Tanzania, you could also visit our booths outside. So just quickly, I would like to just get to hear from Dr. Amina. Um, just a quick framing of the entire conversation. Um, if you could tell the audience, one thing they should start doing, one thing they should stop doing, and one thing they should continue doing around um, climate resilience and improving health for women as well as climate justice, what are those key recommendations you could give our audience? And I'd also love to hear those recommendations from each of the panelists before we open the floor for questions. Thank you.
Thank you. Can you hear me? Thank you, Dr. Hafiz. So I think I'll just thank all the speakers. I learned a lot even from this short conversation. I think for me, what we should start doing, one is that we have heard from the main plenary session about the fact that we have a policy on climate. So can we try to see that these policies are domesticated in each of our states? Because, policies without being domesticated with just keeping them in the federal level will not help. So for all of us here, at least in this conference, can we get to find out where we can get that policy? Can we learn about the policy? Can we then go to our various states to see that we push for this policy enactment at the state level? The second thing is resources. We cannot do anything related to climate resilience or building or strengthening systems without resources. So can we talk to all the world banks, the donors, and the government for domestic resource mobilization for climate justice? How much are we actually earmarking at the government level for climate and health? The third thing that I think we should start doing, we learned about school clubs. Can we initiate in the various schools that we know, our children's schools, our friends school, maybe climate, or what, I don't know what to call it. They call it the complete PHE, which is the population health and environment. But if we can have clubs in our schools, especially from primary to secondary schools, about climate, so that they will learn about climate. Nobody teaches you climate. You learn about agriculture, you learn health, you learn education, all separately. But all these issues about the climate issues are just some things that are coming up recently, and we're connecting the dots because of the relationship. Another thing I think we should start doing, that's the last one, is to also, in our own local environments, in our homes, how do we make our own homes to be climate friendly, to be model homes? How do we make schools and also health facilities? We've learned about Tanzania having green clinics, and these are very few criteria. For instance, what kind of electricity do you use? There are a lot of things. Even now that fuel or petrol is so expensive, there's a lot of talk around the natural gases. So I think sometimes we're even driven because of the issues that we have, not because we want to do them, but we have to do them. And I think another thing is also inclusion. We've been talking, and I'm happy that Mr. Kenneth mentioned disability. Not only women and girls, what of the disability community? They are very, very much impacted by climate and health issues. Those young people that are also affected by gender-based violence due to climate issues, due to any disasters that happen, how do we support them to have more better access both to healthcare, to education, to development in general? So thank you.
Thank you very much. Mr. Abdullah and Salam, could you just share quick recommendations to the audience on what they should?
Thank you. Thank you. Okay, yeah. Thank you, Dr. Amina. I think she mentioned very important points. And as we have already established that climate change is a multifaceted issue, it is only fair that finance that come in from different angles. So I'm talking about national funds now. Of course, we know that there are lots of international fundings that are supporting Nigeria in climate change aspects. I think earlier this year, GIFSEP had hosted a review about the climate change percentage of for the National Appropriation Bill of 2024, and it was only 5%. And now we've talked about how climate change affects every other issue, but at the end of the day, all we are getting is only 5%. So in the work we do, in our advocacy, in every other thing, it is important that we try to keep advocating and letting the government know that from every other sector too, they should make provisions for climate change under their own segments. And I think that way we can have a more inclusive and robust conversation across. Thank you.
All right, thank you very much, Mr. Kenneth. Just key recommendations before we open up the floor and we'll close up the session.
Okay, they have said everything. So I'll just ice it. For Oxfam in Nigeria, we are fighting inequality and poverty and making sure everybody is not left behind. We have pursued policies in state climate policies we are pursuing right now Adamawa, Nasarawa State and Bauchi State. So you can also key into that. And my final word will be, how can we hold the governments accountable? It is our duty to follow the money, the climate money coming in. Most times the money comes in. I'm challenging the media, I'm challenging the youth here. Follow the money, the climate money. Where is it going to? How is it spent? How is it impacting us? If not, we'll just be here and still we keep speaking the same language. The inequality will keep widening and we'll still be talking climate justice. Thank you very much.
All right, thank you very much. Mr. Festo, could you just give us your key recommendations to the audience before we open up the floor? Thank you.
Okay, thank you very much. My recommendation would be encouraging on collaboration. I think climate issue is an issue which is intersectoral, and it's very much important to have collaboration between different sectors. So that's what I could recommend when dealing with climate change and building climate resilience. Thank you.
All right, thank you very much. So could we have two questions from the audience? One, this is a women-led session, so we need the session to be balanced. So we need a female and a male. Okay, so we have two males.
Good afternoon, everyone. My name is Noura Nasir. I work with Society for Family Health. Point of correction, it's a female-led, and we want to see a male active. For me, I don't mind seeing all male championing or fighting for right. For me, that is what I always. All right, so I want to start by saying, I want to see men championing the cause So I purposely chose this side, I guess because of my passion for women and girls. So, but I like to say that I will be surprised next year will be in another venue discussing the same issues, same problems, and the same thing. So, what is my point? That at individual level, what can we do in our own lives? I think that's the challenge. I can quickly share a story that I said, in war against indiscipline, I was in primary school. And that I located that up to this moment, I don't live. So there are things we can do in here. Then at systems level, I'm sure a lot is being done, it's going on. But I think there are problems that are inside, right? So we need a coordination mechanism and a system and a system. That's it.
All right, thank you very much. Please, a round of applause for him because I see a he for she advocate. So please,
Yeah.
round of applause for him. Next.
Thank you very much. My name is Ibrahim Shahesa. I work with Sidan Group. My question is still ensuring that coordination. There are programs happening across some states. ACRISA, something of such. This, I may not have a detail of what this framework of this project is all about, but I think with all these effects of climate change we're seeing around women and children, perhaps this can also be, reframed to address issues around that, because there are so many interventions they are doing, not just only about planting trees or doing drainage system. We can see a lot of things happening, and I think maybe perhaps I can see the Ministry of Environment, which know more about their framework, and perhaps if those things can be used also to address issues relating to women and children. Thank you.
All right. Thank you very much. So I want the partner to just keep note on that before we close.
Yeah, just first of all, thank you to all of you. I know it's time and we're still here. And if we planned for an hour, but we're given less than that. That is one. And then secondly, thank you for your questions. I don't know why my gender didn't want to answer any question. I mean, ask any question. You're on board. Okay, so I think the first thing is to also address my colleague, you that the he for she. I think first of all, just to say that, we are very, very impressed by your statement about men needing to change or leading the women agenda. But the honest truth is that men can never be women. And the experiences of women are special experiences. And a woman leading and making sure that they speak out for their fellow woman can never be the same if it is a man speaking out. For me, I don't know, I'm not a man. I can never speak on behalf of a man. I can speak on behalf of my people because of the experiences I've gone through. So please, even though we want you all to be with us, but we want women to speak up, to voice up, and to speak for ourselves. Thank you very much. And then the second thing is that I think your comment was more of what can we do, and the issue about collaboration is very critical. For instance, you talked about the projects. I'm just trying to hurry up so that I just touch on the points that I wanted to touch on. I think for us, climate should be intertwined, should be interconnected, should be integrated in everything we do. In everything we do from our homes. And this is, I can't stay here in 10 minutes of having to talk about how we can incorporate climate into our work. But please, let's try that whatever we're doing, and especially in the health system, health workers have to be trained because it's a special thing. Even gadgets or wares that people wear during climate crisis, during droughts, and they are very different. So it's so challenging to even know that from the community, and also ensuring that communities are part of whatever solutions that we provide in the climate nexus, in the climate ecosystem. So unfortunately, I don't know, we have not really answered all the questions. Please feel free, as Hafiz mentioned, to go to our booth to get there's a barcode and learn more about our work, because we're doing a lot of climate work across the world. You can hear from our Tanzania colleagues. I learned a lot when I went to Egypt last time, and how they are putting women at the center and doing so much in their households, doing climate smart activities, and then in the schools and in the health facilities. Our mandate and our aim is to ensure that we are all we all build and support the building of a more sustainable and resilient health systems, because the issues about women and girls are special, and also to have women leaders at the forefront of climate and health resilience activities. Thank you.
All right. Thank you very much. All right. Please, a round of applause for yourselves. That's not loud enough, you know. And a round of applause to the speaker. Um, as we try to wrap up this event, I would like to thank you all and also the speakers for taking your time out to be here to just have this, I would call it a lightning talk, because for me, this was not a panel discussion. We've not started discussing, but this is a lightning talk to spark up new conversation. And I believe that some of the insights shared here will spark new ideas and new approaches to how we do our work. So thank you very much, Mr. Festus, for joining us. Thank you very much, Mr. Kenneth, Mrs. Abidat, and Dr. Imuna. Thank you very much. And we also want to thank you all for joining us, and thank you very much. And we look forward to seeing you all in future events. Please come and network with us at our booths. And do have a nice rest of the day. Thank you very much.
Thank you.
All right, so they also said lunch has started and that's the Lady Kwali Hall, and we'd like to take a group picture just with the speakers before we leave the stage. Thank you very much.